state of the health of an individual is equivalent to the state of the health of the colon. Those were the words by Hollywood actor Woody Harrelson. With the months of January and February slowly moving past the rearview mirror, we look forward to March as we celebrate Colorectal Cancer Awareness Month. We're here to take part by talking about one of the most common types of cancer in our country, colorectal cancer. Globally, colorectal cancer ranks second in terms of cancer related fatalities and the third most common cancer among Filipinos. But what is more of this disease? What are the diagnostic process and what are the symptoms that comes with it? In today's episode, we will find out the answers to these questions and more. So sit back, relax, and enjoy this informative journey. This is Jed Liano, your host for today's episode of Lifeline, where we improve our lives by feeding our minds. For today's episode, we are joined here by Dr. Ryan Agas, a radiation oncologist at the Benavides Cancer Institute in UST Hospital. Thank you so much po, Doc, for taking your time. Kamusta man po kayo?
I'm doing good, and thank you for the invite as well. This is my third time for Tiger TV.
Yes, and it's really, again, it's such an honor for the third time for you to be here with us today. So now, Doc, to start off for our discussion for today, in one sentence, can you explain to our viewers and to all our audiences what a radiation oncologist is?
One sentence, okay. Basically, a radiation oncologist is a doctor who treats tumors, especially cancers, with radiation. So, more commonly, we use X-rays, so high energy X-rays to treat the cancer.
So these are the doctors that really treat cancer. So now, Doc, let's move forward to our topic for today, which is colorectal cancer. So as your specialization, we'd like to ask, what is colorectal cancer?
So colorectal cancer is basically a new growth or abnormal growth or tumor which appears inside the or in the lumen of the colon and rectum. So colon and rectum, these are basically the last parts of our bowel, no? And these tumors, they have the capacity, they are considered to be malignant. So they have the capacity to either spread locally in the adjacent areas or they can also go to distant sites, spread to other sites of the body.
Yes. So what are the general risk factors naman po when it comes to this kind of cancer, which is colorectal cancer?
Okay, risk factors. So, of course, family history is a strong risk factor, especially patients with known hereditary colorectal cancer syndromes. No, in terms of lifestyle, there's known lifestyle risk factors associated with colorectal cancer, including obesity, increased intake of fatty food, especially processed meat, and actually even excessive alcohol intake has also been recently shown to be associated with increased risk for colorectal cancer.
So family history and lifestyle are the kumbaga two biggest factors
Yeah.
po for colorectal cancer. So now, as a radiation oncologist, how does radiation therapy treat colorectal cancer?
So colorectal cancer, actually colon and the rectum, these are treated differently. So for colon cancers, our role as radiation oncologists or rad-oncs, we call ourselves rad-oncs. Our role is quite limited, no, for colon cancer. For rectal cancer, our role is quite important in shrinking the tumor. So we usually give radiotherapy before the surgery to shrink the tumor and facilitate a good surgery. So surgery is still the most important treatment.
Yes. So in detecting colorectal cancer, Doc, can you run us through some of the most common process or kumbaga paano madedetect or how yung mga diagnostic processes and how accessible are these in terms of here in the Philippines?
Okay, so how are colorectal cancers diagnosed now? In question.
Yes.
So it's basically the first doctor that sees the patient would be the gastroenterologist.
Yes.
So either through screening tests or diagnostic tests, pinaka-common diagnostic modality to diagnose colorectal cancer is through colonoscopies. So
Yes.
basically, these are tubes with a camera.
Mm.
So the gastroenterologists do that, and so they can see specifically there on how, where the tumor is inside the bowel, and then usually they can take out if it's just a small tumor, they can take out it or completely like a polyp. If it's a bulky tumor na in the bowel, they can just take a sample of the tumor, and then it's read by the pathologist sa microscope to make sure na it's a malignant tumor or not. No? So that's the first part, the colonoscopy. Um, it's widely available naman locally here. We have that, of course, in UST.
Yes.
And then the next part, once you know that there's a tumor that is cancerous or malignant, the next step is to stage the patient. And the most commonly used modality to stage patients are CT scans.
CT scan.
CT scans both for the whole abdomen and for the chest as well, because colorectal cancers can go to the lungs.
Mhm.
So CT scans widely available all around the Philippines as well. No, for certain, specifically for rectal cancer, there's another modality that we use. Either an MRI or endorectal ultrasound. No, dito mas limited yung availability, but there's plenty of centers
Yes.
available MRI and endorectal ultrasound. This is specifically to identify what the stage of the tumor is. Kasi both of these modalities, they can look at the layers of the bowel wall, which are these are important for staging rectal cancer patients.
So, marami talagang, kumbaga, process na nag-undergo for us to identify this. And it's good na kahit papano, these processes are accessible here in the Philippines. So, those were some great insights, Doc. And I'm sure our audience has gathered some wisdom from your words. So now, Doc, for this next segment, we can call it mythical operation, where we dissect facts from misinformation. So, the way this works po is we're going to read a statement and you tell us whether it is a fact or a myth.
Okay.
So, get naman po, Doc. So, let's begin. So, first, fact or myth? My family history is a risk factor in getting colorectal cancer.
As I mentioned, yes, it's a fact.
Yes. So next, fact or myth, screening is only necessary when symptoms occur.
It's a myth. To explain it further, I think we need to dissect the question. No? Kasi for patients with symptoms, there's a difference between screening and diagnostic tests. So screening tests are only done for patients who without symptoms. So mga healthy patients, no bowel symptoms, they're the patients we screen. Patients who already have symptoms, like for example, may blood in the stool, we need to do diagnostic. Those are considered diagnostic tests. No? So to answer the question, it's a myth.
Yan. So guys, magkaiba daw ang screening and diagnostic. So screening are for those for healthy people, normal, and for those diagnostic, ito na yung may mga symptoms na.
Correct.
Alright, so last one, Doc, fact or myth? Only older people can have colorectal cancer.
It's a myth. No. To explain further, most patients, age actually is a risk factor. So increasing age. So older patients, we do see more rectal cancers. Siguro ang median age nasa 60 to 70.
Yes.
But we do see young patients. Actually, there's an increase. If we look at data now, there's an increase of colorectal cancer patients in the young, less than 50 years old. In fact, siguro, a perfect example is a well-known, well-loved professional basketball player. I think he was diagnosed a couple of years ago with colon cancer. No, he's just 37 years old.
Wow.
So we do see colorectal cancer in the young.
So we definitely could note that hindi lang yung mga old people talaga nagkakaroon ng colorectal cancer. And that concludes our mythical operation segment with Doc. But when we come back, we'll be hearing more from Dr. Ryan Agas as we talk about the symptoms, prevention, and treatment for colorectal cancer. Only here on Lifeline.
We are happy to be part of this global activity of spreading awareness against cancer. UST Hospital, together with the Tomasian community, is working together to educate our medical staff and patients to contribute in making this world a cancer-free place. Through this effort, may we promote healthy lifestyle, enhance awareness among Filipino people, and make a mark in reducing the global impact of cancer. We salute the men and women who continuously fight to survive and win this battle against cancer. Together, let's close the gap in the treatment of cancer care.
The will to live is a natural desire for all human persons, especially those who are battling diseases just like cancer. The whole Tomasian community, especially the University of Santo Tomas Hospital, through its Benavides Cancer Institute, commits itself in its fight against cancer. Together as Tomasians, let us support those people who have dedicated their lives in terms of their research and study about cancer. Let us hope and pray for cancer patients that they might have renewed faith and hope that their health may be restored and that happiness may reign in their families. God bless us all.
Welcome back. Previously, Dr. Ryan Agas informed us of colorectal cancer by answering questions and playing a round of mythical operation. For this last segment, we'll be discussing the symptoms, prevention, and treatment for colorectal cancer. And so let's not waste any more time and dive right into the questions. So now, Doc, it is said that colorectal cancer frequently exhibits no symptoms in the early stages. So with that in mind, what age should a person start coming in for routine checks?
So it's actually this the line of a gastroenterologist. No? So the gastroenterologists are the ones who usually screen patients. But in general, from what I know, standard age for screening is for the general population. No? So the population that is not at increased risk, it's 45 years old. So you should start screening at 45 years old.
All right. So with that in mind, Doc, how frequently should an adult, let's say yun nga, a 45-year-old adult, get routine checks like this?
So it depends on the type of screening test that you prefer. So there are two general types. So the first one is testing the stool for blood. It's more commonly done now, I know, with the FIT test, the fecal immunohistochemical test. No? So with the FIT test, it's usually recommended to be done. It's a very simple test naman. It's usually recommended to be done annually, so every year. The other is using endoscopy. No? So if you do a colonoscopy, seeing the entire colon, for the general population, yung the higher risk, the recommendation is every 10 years na colonoscopy.
All right, po, Doc. So now, Doc, is early detection a factor in determining what kind of treatment will be done to the patient, whether it's choosing between chemotherapy or surgery or other kinds of treatments?
Definitely. It's always easier to treat early stage cancer. No? So for early stage cancer, in general, they can be cured, they can be treated with only a single modality. No? So for example, when I say single modality, pwedeng surgery lang. So actually, in very early colorectal cancer, they can actually be treated with minimal surgery. So hindi siya aggressive surgery. No?
Mm-mm.
The higher you go up, the more modalities, more treatments you need. So if you go to stage 2, stage 3, especially stage 3 disease, these patients would require a combination of surgery, chemotherapy, and for some patients, radiotherapy as well.
Yes. So we could say na at the age of when we step into 45, dapat maganda na magpa-test na tayo so that
course,
we
yeah.
could avoid these complications to get even deeper. So aside from medical care, how does emotional supportive care play a role in the patient's journey to colorectal cancer?
Extremely important, especially for patients who not only during their diagnosis, coping with diagnosis, but also with the coping with the long-term effects. So even the patients who are survivors, they need emotional support, especially with regards to the long-term effects of not only the tumor, the cancer, but also the treatment. No, so really important. So we have support groups for that. Mm.
Yes. So it's really important that we have to be there for our patients. So to all our viewers out there, if you guys have friends, family, relatives that are undergoing treatment for colorectal cancer, it's really important that we have to be there for them. So now, Doc, after a person has been diagnosed with colorectal cancer, what are the most common lifestyle changes that they need to adopt?
In terms of lifestyle changes, I mean, of things that I advise the patients, in general, nothing different than the healthy individual, no? So a healthy lifestyle, a healthy, well-balanced diet is always good. Being active is good for not only for the colorectal cancer patients, but also healthy individuals, no? But I think the adjustment would basically be with the effects, long-term effects of treatment. For example, a very important adjustment that they need to do specifically for patients with rectal cancers na malapit na doon sa anus. These patients usually would need a permanent colostomy. So a permanent colostomy, what happens there is the most the lowest part of the colon that was not touched during surgery would be put out in the abdomen. So and then the upper and this will be there permanently, and a bag will be placed. No, so basically they will be moving their bowels. There's bowels through the bag.
Yes.
So that really requires a lot of adjustment for these patients. No?
So we definitely can advise, bottom line, that we should all stay healthy in all the things that we do to avoid these cancer or getting any kinds of disease. So now that we're more informationally equipped, do you have any message, Doc, or advice to give to our patients or just someone who has a loved one going through colorectal cancer, especially during Colorectal Cancer Awareness Month this March?
I think my main message would be, of course, being diagnosed with colorectal cancer is never good news. But what I do know it's not automatically a death sentence. No, so especially with the advanced treatments modalities that we have now, it is potentially curable. And the most important thing is to seek appropriate consultation, appropriate help from the specialists or the team of specialists. No, hindi lang siya one doctor; it's a team of specialists that you need to approach. You know, so that's the most important thing.
Yeah, thank you so much, Doc. So yan guys, having colorectal cancer does not mean the end for you guys, because here in the Philippines or in general, it's potentially curable. So that's it for today's episode of Lifeline. Thank you so much, Dr. Ryan Agas, for taking the time to be here and answering our questions regarding this topic. When it comes to medical knowledge, ignorance is indeed not bliss. And as we celebrate Colorectal Cancer Awareness Month, we must be reminded not to neglect this part of our body. All of the staff here on Lifeline hope that this episode has served its purpose in spreading knowledge on the specific type of cancer. Always feel the roar by following us on our socials at UST Tiger TV and at UST Tiger Radio. Once again, I am Jed Liano, and this has been Lifeline, where we improve our lives by feeding our minds.